and welcome. My name is Dr. Calliope, and I'm going to be taking care of you today. Would you mind if I just grabbed your name and date of birth, just to confirm? Very good. So, you are indeed who you say you are. And is that your preferred name? How do you like to be addressed? Very good. Today we are going to be doing a full medical assessment. This will include some neurological questions. We'll be taking a look at your head, at your eyes, nose, ears, mouth, your lymph nodes, your heart and lungs, your reflexes, your hands and feet. Pretty much a head to toe sort of assessment. Is that okay with you? Very good. Now, for the purposes of this examination, I will need to be touching you. Is that okay with you? Do I have your consent to do that? Very good. Thank you. So I am all scrubbed up and ready to go. And if you are ready, I'd like to start with a very brief neurological check. That's okay. Okay. So, firstly, do you know what today's date is? Today's date. Very good. And what was the time of your appointment today? Very good. And where are we? What building? What city? Very good. So, you are oriented to time, place, and person when I asked you to confirm who you were. And now I'd like to proceed with a head examination. And this is just going to involve me palpating around your head. I'm going to be palpating the lymph nodes as well, from the back of the head to the ears, under the jaw, down the neck, and along the clavicle. We'll also be looking at your thyroid, dialing in on some special parts. Now, from time to time, I will be just writing things down, but I would like to just start by taking a look at the hairline and at the scalp. Okay? I'm going to get quite close here. I'm going to get a little close. And let's see. Very good. Just taking a peek along the hairline here. Good. And right around the ear, as well as the back of the ear. I'm just going to part your hair a little bit here so that I can see adequately. Good. And the other side, I'm just going to take a little look over here. Okay, and along the back of the head. Good. And the other side as well. Now, I'm going to be doing some palpation here. Just going to finger comb the hair a little bit, and then this might feel quite akin to a massage. And you haven't been having any headaches, haven't suffered any bumps on the head, nothing of that sort. Good. And I'd like to feel, starting at the hairline in the back, I'm going to be checking the occipital nodes and working forward from there, working through the chain of lymph nodes. Okay, we have the occipital nodes. And then we come behind the ears. This is the post-auricular nodes. Pre-auricular nodes, and underneath the jaw we have submental and submandibular. Get a bit of a rolling motion here to feel these, and then down the neck here. This is where we have nodes like the deep cervical nodes or superficial cervical. There's a few different groups in here. And then we come down to just above the clavicle here. This is supraclavicular, above the clavicle. Some of these names are pretty intuitive. Okay. Right, now I'd like to take a little look at your thyroid. So I'm just going to be palpating right at the front of the throat, and it might be a little uncomfortable. I'll be quite quick about it. And if you could just take a dry swallow for me. Okay, good. Very good. You'll give me just a moment. Now I'd like to do some palpation of the masseter muscle, the temporomandibular joint, as well as the temporalis muscle right up here. So I'd like to just do a little bit of palpation first. Here, the muscle in the joint. Very sensitive, this area. Many of us can attest having some sort of soreness here. And if you could just clench your jaw for me. Unclench. Clench. and unclench. And now I'm going to feel just at the temples here. Good. And if you could just clench the jaw, unclench, clench, and unclench. Good. Very good. Now I'd like to do some direct percussion on the sinus cavities. So we have the ethmoid, we have the maxillary, and the frontal sinuses. I'm going to be pressing and tapping along. I just want you to let me know if there is any pain or tenderness in any of this. So I'd like to come here and just press. Any pain there? Okay, I'm pressing along the maxillary. Good, and the frontal here. Okay, nothing there. Then we'll get into that tapping, that direct percussion. Just a little tap, 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 tap. Okay. Any tenderness as I'm tapping here? What about up here? Any pain or tenderness with any of that? No. Now I'd like to test your facial cranial nerve, and this nerve governs the facial expressions, the movement you make to make these expressions. So if you wouldn't mind, I would like you to follow my instructions real quick, and I'll have you make a few different expressions for me. So firstly, if you could raise your eyebrows. Good. And can you close your eyes real tight? Real tight. Good. And can you puff out your cheeks? Good. And can you smile real wide? Yep. You can show your teeth if you want. Okay. And can you frown? Very good. Excellent. Now we're going to test a few more cranial nerves. And I'm going to get the help of a couple of tools for this. We'll start with the soft, sharp sensation test. We're going to be testing the trigeminal nerve, cranial nerve number 5. And to do that, I have a hidden little point in my hammer and a hidden little brush. So I'm going to pull those out real quick. Okay. A little pointed tip. And a little brush. Very handy. Now, this is going to be our sharp point. However, it is not going to pierce the skin. As you can see, I'm pressing in quite a bit, and I'm just getting a little bit of a residual mark. I am not going to be pressing nearly as hard for you. I'm just going to be doing this sort of pressure just enough for your skin to register the object. And then we also have our little brush here. So I just need you to tell me whether you feel a soft or sharp sensation. And I'm going to be testing this sensation real quick, just on the jaw here, so you know what that feels like. This is the sharp. Okay. And this is the soft. Right? Good. So, if you could just close your eyes for me. No peeking, no cheating. And we'll do soft or sharp, right? Okay. Soft. Soft. Sharp. Sharp. Soft. 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 Sharp. Soft. Soft. Sharp. Soft. Sharp. 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 Soft. And soft. Very good. Let me put these back. And then we're going to be testing the hypoglossal nerve. So, the hypoglossal nerve governs your tongue movement. So if I could have you just stick out your tongue real quick. Good. And if you could move it to one side. Good. The other. Up. And down. Very good. And you can put your tongue back in your mouth. Really simple test, yeah. Makes it easy. Let's take a little detour. I'd like to do a little inspection of your nose and your mouth, and then we'll do a little bit of a range of movement test. So I am going to just grab a flashlight so that I can look inside the nose as well as the mouth. And I'm going to have you tip your head back just a little bit so that I can see inside the nasal passages. Okay, this might be a little bright. You can close your eyes if you need. Just need to take a little peek here. Good, okay. Alright, septum looks good. Nasal passages are clear. Good, and you can go ahead and bring your head back down. And then we're going to take a look at the mouth and the throat and the teeth. So I'm going to look at the mouth just as it is. Pallor is good. No blue or dusky color. Overly red, not chapped, which is very good. We're going to be getting into that sort of thing soon. Okay, and if you could open your mouth, I just want to take a peek at the corners of the mouth there. Good, those look good. Now, I'm just going to take a look. I'm going to put this here in the pocket of your cheek. I want to take a look at the teeth. Nothing too crazy, just making sure I'm not seeing any obvious caries. Checking the color, that sort of thing. And if you could just lift your tongue to the roof of your mouth. Good. Good, okay. And if you could put your tongue down, I'm going to depress the tongue. Good. Give me a moment. I just want to check the wall of the throat, looking for cobblestoning, irritation, looking for the tonsils, if those are present. Good. And if you could say ah for me. Good. Okay, uvula's all good. All right. And you can close your mouth. Good. And let's do a little bit of range of movement. So I'm going to ask you to move your head around a little. And then for cranial nerve 11, we're going to do your shoulders a bit. So I'm going to have you follow a few instructions. If you could just nod your head forward. Good. And go all the way back. Okay. And if you could turn your head to one side. And the other. And can you tilt your head to one shoulder and the other? Good. Now I'm going to put my hand on one side of your face and I want you to turn against my resistance, all right? So if I put my hand right here, I want you to turn against the resistance. Good. The other side. Turn against. Okay, good. And was there any pain there? Did it feel weak at all? No. And now let's do the shoulders. So if you could bring the shoulders up and down. Up and down. Good. Now I'm going to have you keep them up. I'm going to try to press them down, and I want you to resist me. Good. And now if you could put them down, I want you to shrug up against my resistance. Good, good. Very good. Strong shoulders. Strong shoulders. At the eyes now. We're going to hone in on the eyes. And I'm just going to have a little external inspection. And look at the hair distribution of the eyebrows, of the eyelashes, as well as the tear ducts. Look at the conjunctiva, the sclera, the iris. We'll get a little more into the pupil as well. I'm going to pull down on the eyelids. I just want you to look up for me. Okay, I'm going to pull down, you look up. Good, and I'm going to pull up, and I want you to look down. I'm just going to pull up, you look down. Good, good. And have you had any issues with vision changes, wateriness, itchiness, dryness, irritation, burning, redness, anything like that? Anything with the eyes? No. Okay, very good. Let's take a peek at those eyes of yours, those pupils, with a little bit of light. Now, as I've been looking here, so far your pupils have been equal size, and I'm going to bring in some light, and we're looking for the pupils to be equal, round, and reactive to the light. Good. You know, there are some things that remain fascinating, even when doing something for years and years. And one of those things is the pupillary movement. I'm just putting a little bit of light into the eye, and those little muscles, the fastest muscles we have, just go in and out and in and out. It's so cool. Now, let's see. We're going to be doing a little bit of eye movement. Yes, we'll be doing some eye movement and looking at the peripheral fields. So I am going to have you just look at my finger here, and using only your eyes, without moving your head, I just want you to follow this finger. Okay, we're going to bring this here. Just do the best that you can. Good. Just keep following the finger. Follow the finger. Good. This is sometimes called the H test because we are moving the eyes in the shape of an H. Good. And then we're going to go diagonally up. Keep following my finger best as you can. Keep following the finger. So as I make these diagonal movements, good. So oculomotor, trochlear, and abducens nerves look great. Now we're going to do a little bit of a peripheral fields test. I am going to have you take a look at my nose and just keep your eyes focused there. And I'm going to wiggle my fingers in your peripheral vision. And I just want you to tell me when it is that you see my fingers wiggle. So just keep looking at my nose. Try to get you right off the bat. Good. You're too quick. Can't trick you. Good. Good. Yep. Good. Good. Right. I threw quite a few sneakies in there, but you and your peripheral fields are doing just fine. Now, let's bring in our ophthalmoscope for what it is truly to be used for. and we are going to perform what's known as a fundoscopy. And this means that I am going to be taking a look at the back of your eye, just using this little tool. Just a little light, little lens, and I can see everything in the back of the eye. I can see the optic disc, the fovea, and the blood vessels in the back of the eye. Good, and I'm just going to adjust the dial a bit. There we go. Right. And I'm going to put my hand on top of your head so that I can steady myself and I won't bump into you. And I'm going to come in at an oblique angle. And we start by looking for something known as the red light reflex. And then we come in real slow and look around the eye. So we have the optic disc is pretty obvious. See the blood vessels. Good. See the little darker area. There's a little bit of a darker area and then a darker still area. Good. Come in real close. So, we have the optic disc where the optic nerve goes back to the brain. We have the fovea, and in the middle, we have the macula. Good. A little bit longer. Just want to make sure everything's in tip-top shape. All right. Looks good. You have some healthy eyes there. Now let's move on to the ears. I'm going to be inspecting the ears. We're going to take a little look with the otoscope, and we're going to be doing a brief hearing test as well as the Weber and Rinne tests. So for this, I'm going to need to switch out the head here. A new speculum. And then let's take a peek at the ears. So I'm just looking at the external structure. We have the pinna here, and up top we have the helix, the bottom, little fleshy part, that is the lobe. We have the tragus right here, antitragus, and that little bowl area is the concha. And we have a bunch of different structures in the ears. The external ear. All these little folds that help guide the sound to our ear and make it sound the way that it does. There's a lot of cool science behind it. The world is wide and oh my, is it something? Good. I'm going to take a peek behind the ears. So that's not something we can really see on our own, but it is something that we can have some issues with. Mostly skin abnormalities or lesions back here. Good. And just this is looking pretty clear. I didn't notice anything when I was first doing my examination. I was looking at the hairline. But just to be sure, now I would like to do a little hearing test before we grab the otoscope. I am just going to be rustling my fingers, rubbing them together. I just want you to tell me which side you hear it on, whether it's your left or your right. So if you could just close your eyes, no peeking, no cheating, and tell me which side you hear the rubbing / rustling on. Good. Good. Yes. Good. Good. Too quick. Yep. Very good. That'll do. And let's bring out the otoscope. Now, I am just going to very gently look inside the ears. And I'm going to pull up and back on the ear canal. And then we'll take a peek in the ear. Now we're looking for any issues with the air distribution or cerumen, which is the waxy substance your ear makes to help protect and clean itself. We're looking at the tympanic membrane or the eardrum. Good. Good. Right, so this ear looks pretty good. Just making sure I can see my landmarks. Okay, let me go ahead and just... And then we'll check the other ear. Good. So we are looking for things like perforation of the tympanic membrane, bulging of the membrane, looking for redness or irritation in the ear canal, blockages of cerumen, looking to make sure that the tip of the malleus behind the membrane is visible, and that there is something known as the cone of light, which is light reflecting back at you, and that it's in the right position. Good. Good, and this ear looks good too, so I'm just going to... Good. And lastly with the ears, we're going to be doing the Weber and Rinne tests. So I have a 512 hertz tuning and I'm going to be putting it right in the center of where your hairline would be. And I'm going to ask you to tell me which side you hear it on, or if it's right in the middle. And then I'm also going to strike it and put it right on the mastoid process behind the ear. And you'll tell me when you hear it, when it stops. And then I'll put it right in front of the ear. And you tell me when you hear it and when it stops. So I'm going to start with just striking it and putting it on the top of the forehead. Is that more on one side? The other right in the middle. Okay, one more time. Okay, good. Right in the middle. Now we'll do right behind the ears. Let me know when you hear it and when it stops. I'll put it right in front of the ear. Tell me when you hear it and when it stops. Hear that? It stops. Good. Stops. And it stops. Good. Stops. It stops. Good. Stops. Good. And it stops. Good. No signs of hearing loss. Now we're going to be bringing in the stethoscope. And we're going to be listening to your lungs after I've had a chance to do some percussion. Now for percussion, it's going to be like when I was tapping on your sinuses, but this is an indirect percussion in which I'm going to be tapping on my finger and listening to the sounds that come back, whether it's hyper-resonant or if it's dull and stony. It can tell me a little bit about what's going on with the lungs. So I am just going to do some percussion along the lungs, along the chest here. Good, and we'll do some auscultation. And I'm just going to prompt you when I would like you to breathe. We're going to do some deep breaths. So I'm going to put the diaphragm of the stethoscope on your chest, and I'd just like you to take a deep breath in and out. Deep breath in Deep breath in and out. 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 Now I'm going to be doing a little test with you called vocal resonance. And I am going to have you say the word 99 when I put the diaphragm on your chest. And I'm going to be listening to how the word sounds in your chest as you're saying it. So I'm just going to put the diaphragm here. If you could say 99, 99, 99. Now I'm just going to be getting up and moving to the back so that I can do the percussion, the auscultation, and the vocal resonance on your back. So I will be just a moment and we'll do that all over again. Okay, so I'm going to do the percussion on your back first. Good. Good. And then I'm going to pop in the stethoscope and we will do some auscultation. So if you could just take a deep breath in for me and out. Deep breath in 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 and out. Last one. Deep breath in and out. Good. Very good. Now we're going to start again with the vocal resonance. So if I could have you say 99. Good. 99. 99. 99. 99. 99. 99. 99. Good. And while I'm back here, I'm going to do a little bit of palpation of the spine. So if I could just have you hold still, I'm going to start at the very top and work my way down. Good. And is there any pain as I'm palpating here? No. Okay, and I'm just going to do a little bit of palpation here at the sacrum and look for any sacral edema. Okay, and that looks good. So I'm going to come around and come back in front of you. We're going to be taking a look at the carotid, and I'm going to have you lay back for a minute, and I'm going to look for something called jugular venous distension. So I could have you just lay back. Very good. And if you could turn your head to the side, just going to be watching your neck there. There's going to be a little movement. The pulse jumps just a little bit. But we want to make sure that it's not an inappropriate sort of movement. Much too much movement, if you will. Okay, good. And if you could come back to sitting, right? I am going to take a little listen to the carotid artery, and then if everything checks out, we'll do a little bit of palpation as well. So if I could have you just take a deep breath in for me and hold it so that I can listen clearly. Very good, and you can go ahead and exhale. Good, and take another deep breath in and hold. Good. Okay, and exhale. Good, so no signs of any bruits. Those are audible heart murmurs. I'm going to do a little bit of palpation here. I'm going to do it just one side at a time. Good. And the other side. Very good. It looks good. And we're going to be moving on to the heart. First, I'm going to do some palpation. I'm going to be using my hand, and we're going to be feeling for any heaves or thrills, and these are palpable heart murmurs. So I'm just going to put my hand on your chest here. There's a couple positions here to be able to feel for the best. Good, and now I'm going to be palpating the apex beat. This should be the mid-clavicular line, 5th intercostal space down, and I can just meet my fingers. So we have mid-clavicular line right here, and then we can count 1, 2, intercostals, and then I can just sit here a moment and feel for that apex beat. And now let's do some auscultation. Good. And we're going to start by listening to the aortic area of the heart. So you can breathe normally for this. Good. Moving to the pulmonary area. And tricuspid. And the mitral valve. Very good. Very good. To the abdomen, and we are going to auscultate, palpate, and percuss. So you can go ahead and just breathe normally here as well. Good. I'm going to be doing a light and a deep palpation. The light is just going to be one hand. It is more of a medium pressure, however. The deep palpation is going to be with two hands, and it is going to be quite deep. It may be a little uncomfortable, but I'm just going to have you breathe through it, and it doesn't last very long at all. So we're going to start with the light palpation here. Do let me know if there's any pain or tenderness. Okay, all good? All right, so we're going to go in with the deep pressure. Just keep breathing through it, all right? To put a little bit of force into it, really. Okay, all good? All right, very good. And now I'm just going to be doing some percussion here. Looks good. Now, believe it or not, we are almost done. We're going to be doing your hands, arms, legs, feet, a little bit of coordination, and reflexes. So let's start by taking a peek at the arms and hands. If I could just have you hold out your hands for me. Good. I'm just going to do some inspection here. I'm going to use the backs of my hands to assess temperature, make sure there aren't any hot joints, anything of that nature. And if you could show me your elbows real quick. Look for any plaques. Good. And if you could show me the tops of your hands again. I am going to check for the capillary refill. Just pressing down firmly on the nail, releasing and seeing how long it takes for everything to pink back up. Check the circulation. Good, and the fingers themselves look good. They're not swollen. Any issues with the joints at all? No. And if you could flip your hands over, I'd like to look at the palms and the undersides of the fingers. Look for any muscle wasting, any palmar thickening. Good. Okay. So I am going to have you just splay your fingers for me. Good. And I'm going to try to bring them back together. I want you to resist me. Good. And now I want you to hold your fingers all together. Very good. And now I'm going to have you copy some wrist movements. If you could lift your wrists up, down, come in, out. Can you give them just a roll all around, front and back? Very good. And how is all of that? Okay, feels normal to you? Very good. Okay, and you are able to make a fist while you were doing that, but I will have you squeeze onto my hands, okay? Just give them a good squeeze, if you will. Very good, okay. Now let's take a little peek at the legs and feet. So we're going to look at, for example, the shins. Sometimes we can get some skin abnormalities in the shins. And we're going to look as well at the feet. I'm just going to check the capillary refill of the toes. Very good. And I'm going to palpate the pedal pulse here. Kind of a funny phrase, pedal pulse. Very good. Now I'm going to have you move your foot up while I try to press down. Good. And I am going to try to push up, and I want you to resist me. Good. And can you just move your feet up and down? Okay, inside, outside. Good, and just roll them around, front and back. Very good. And I am going to press on the tops of your knees. I'm going to try to press down. I want you to resist me. Good. And I'm going to come underneath the backs of your thighs here, right by the knee. I'm going to try to pull up, and I want you to resist me. Very good. Okay, so we've got some good strength in the legs and feet. And we're going to do just a couple of coordination tests here. So first, I'd like to test for Dysdiadochokinesia, and I am going to have you put your hand on your other hand, palms together, and I want you to flip your hand. Flip it back, flip it forward, and do this as fast as you can. Back and forth, back and forth. Can you do that for me? Yeah, it takes a little bit of coordination. Yep. Good. And if you could do that with the other hand. Back and forth and back and forth and back and forth. Very good. Now I'm going to have you do what's known as the heel to shin test. I'll have you lie back again. Good. And let's pretend my elbow here is your knee, and this is your shin, this is your ankle, all right? You're going to take the heel of your other leg, put it near your knee, run it down your shin to your ankle, and bring it back. So your heel will be sliding down the shin. So this leg right here, we're going to bring your heel up and put it right below your knee. Good, and then just run it down the leg. And if you could pick your heel back up, put it right back where your knee is, and go down again. And just keep doing that cycle a few times. Okay, good. And now we're going to switch. So, if you could put this heel right here on the knee of the other leg right here. Good. And then just run it down the shin to the ankle. Pull off and go down the leg again. Good. And just cycle through that a couple times. Very good. That is just fine. If you want to come back to sitting, we're going to check your reflexes real quick. And then I would like to do just a little bit of balance testing. Kind of goes along with coordination, but it's going to be done with you standing up. So I want to get those reflexes out of the way real quick. So I am going to be using 2 reflex hammers. First we have the Taylor hammer. And the reason that I'm using this is because I want this blade right here. And we're going to be testing your Babinski reflex. I'm just going to be stroking the sole of your foot. And I'm going to watch your toes should curl inwards. So I'm going to take the bottom of your foot and just stroke up the side. Good, and the other side. Very good. And then we'll switch to the buck hammer. And I'm going to be using this to get your Achilles and your knee jerk reflexes here. I'm going to be holding your foot and supporting it a bit. I'm just going to be tapping the hammer on the back of your foot, on your Achilles tendon here. Good. The other foot is going to be supporting it a little bit. Good. And we'll get the knees here. I'd like to do the biceps and triceps reflexes real quick. So I'm going to have you just hold out your arm, and I am going to hold your elbow and just tap the hammer in the crook of your elbow, right where my thumb is pressing into. Good. The other side. Okay. And then I'm going to be bringing your arm up, and I'm going to be tapping right back here. So I'm just going to hold your arm up. Let me take the weight of it. Good. And the other arm, just holding it up. Let me take the weight, let it relax. Good. Good. Very good. And lastly, just a few balance tests. I'm going to have you stand up for me, and I am going to have you stand in place, and I'm going to have you close your eyes. I will be right here, so if you do start to go too much one way or the other, I will be able to stop you from falling. So if you could just close your eyes. Good. You might just sway just a little bit, but correct a little bit too. Good. And now this time I'm going to have you bring your arms up in front of you. I'm going to try to press down on your arms while your eyes are closed, okay? Now I am just going to have you put your arms up. Okay, and if you could close your eyes. Right, I'm going to press down. Release. Okay, good. All right, so your arms didn't do a huge recoil, just correct it. Last test. We're going to do a little bit of watching your gait, watching you walk. I'm going to have you walk to the other end of the room just normally, okay? Just walk to the other end of the room. And if you could come back walking on your toes, walking on the tips of your toes. Good. And can you go back walking on your heels? Walk to the other side on your heels. Good. And can you come back walking with one foot right in front of the other? Just toe to heel, heel to toe. Can you do that coming back? Very good. All right. You can sit down and I'll jot a few notes. I think that is all that I have for you. Do you have any questions at all? No, we are really done. Yes, I know that was quite a long assessment, but you got the full general experience. So, everything from the top of your head to the tips of your toes looks shipshape. Well, if you don't have any questions, I'm just going to sign off. And that will be the end. I'd like to thank you so very much for joining me for this full medical assessment. I hope you have a whale of a day and a good rest of your night. Thank you. Goodbye now. Thank you so much for watching this video. I really appreciate it.
slash pseudoscience and personal attention